Neck pain is one of the most prominent conditions out there, right? Neck pain and back pain. And as an 18-year orthopedic specialist in physical therapy, I now pretty much disagree with the way most neck pain is managed. Treated, managed, and even evaluated. 18 years in the field, my wife's a physical therapist, we started and grew our own practice. We've literally lived and breathed physical therapy, and during this time, I kept going back and getting more and more certifications, orthopedic certifications, manual certifications, really becoming an expert in the field. And I was doing this because I still wasn't getting the results that I wanted. You know, some patients would come in with neck pain and you'd help them a little bit. Some patients would come in, you wouldn't help them at all. Some patients you'd come in, you'd help them, but then their symptoms would come back, and it just, you wanted to keep trying to get better and better at your craft, right? So I got my OCS, my COMT, my McKenzie certification, my fellowship, all of these that put me at the top level of my field. But despite that, still espousing all of the traditional treatments, I started realizing, like, these treatments are just doing more of the same that we get upset with pain management. They're just managing the symptoms. They're not doing anything to treat the underlying cause. And when I started realizing that, and I started getting away from anything that was just temporary relief. So this is your hot pack, your ultrasound, your massage, your TENS unit, right? Your taping, your Graston, your trigger point, all the stuff that it'll feel good in the moment, but it doesn't do anything to cause lasting changes. Once I got away from that and I just started focusing on the things that would cause lasting changes, addressing the neck, the spine, my patients got better, quicker, they stayed better, and now that's what I do. I think the traditional physical therapy approach to neck pain that isn't effective, I think that it's common because that's just what people were told to do, right? It's what people were told to do, and if they're not told to do anything different, we just stay status quo. And a lot of times we're really worried about, like, stirring symptoms up. We really want to protect the spine. And I was like this for the long time in my career, where somebody comes in with neck pain, you do very gentle stretching, right? You do very gentle isometrics, so you're trying not to move the spine and you're trying to just get nice light contractions. You're doing very gentle, like, head nodding, right? You're even doing, like, proprioceptive work, balance work that, you know, the head can right itself on a little bit, trying not to move the spine, trying not to put a lot of force through the spine, where if you start to look at the spine like any other joint, like, let's say you look at the spine like your elbow. If you treated your elbow like we treat the spine, our neck, our low backs, you would, like, clearly see that we're doing the wrong thing. So if I had elbow pain and I was like, all right, now what I want you to do is don't move your elbow. And then when you do start moving it, I only want you to move it this much, and I only want you to use real light resistance. Anybody out there would be like, yeah, that's not gonna work. That's not gonna fix his elbow. You need to restore full motion, and then you need to restore full strength through that motion. And that's what you need to do at your spine. And again, it just makes sense to me. And a hot pack won't do that. TENS unit won't do that. And that's 10 to 20 minutes of your physical therapy session right there. Stretching won't do that. Trigger point won't do that. Traction won't do that. And again, these things can be helpful. They can be, like, complementary, but they really just get in the way of doing more of the stuff that's actually working. I think people tend to look at chiropractic as palliative care, and they tend to look at physical therapy as something that's going to get them better and staying better. But I think we failed as physical therapists. More often than not, we're providing just palliative care. We're making you feel good in the moment. We're not irritating anything, and we're not really getting you to the point where you now are actually better, where you've remodeled tissue, where you've gained and maintained range that you'll now keep. So when I was doing the typical treatments of physical therapy, just like anybody else for, like, chronic neck pain or like reoccurring neck issues, I would see patients, you know, 15, 30, 60 times, right? Like, they'd be a revolving, they would be there for a certain amount of time and maybe keep being there, or they'd be there, they'd go away, they'd come back. Now that I have my approach, now I expect to see a patient, honestly, like, most of the time on max, about 7 sessions. about 7, maybe 10, 7 to 10 sessions, something like that, max. And that's enough time to get this philosophy to them, to show them what they need to do to get significant relief, and then show them what they need to do to get 100% better and stay better. The patients that I get now in my career, they're the train wreck patients. They're the patients that they've had neck pain for years, decades. They've been to physical therapy, they've been to chiropractic, they've done the injections, they've maybe even done fusions or nerve ablations. They've done everything that they possibly could, and they're kind of at their wits' end. They don't know what else to do. And my simple approach, it's just, okay, we're gonna get your spine moving, and a lot of it is getting the thoracic spine moving, the literal base of your neck. Get the thoracic spine moving, and then we're gonna get your muscles contracting strongly in those ranges that we need to move your neck and your spine. It's that simple. And I don't use traction, I don't use hot pack, I don't use stim, I don't use ultrasound, I don't do trigger point anymore, I don't stretch patients' necks anymore, I don't do suboccipital release, I don't do all of this stuff. I don't do craniocervical flexion and suboccipital holds and all of this stuff that I used to do for so long throughout my career and different iterations of. All I do is show you how to move your spine and show you how to get your muscles contracting in that range of motion. If we could get patients that they just had neck pain and it's been there for a month or less, and they could just do what we show in the neck course, they'd be better like that. And it's frustrating that the patients that we get, they're the train wreck patients, they're the 10 plus years of neck pain, and the cool thing is they still get better. It takes them 4 to 5 weeks to get 50%, but they still get better, and they start realizing that everything that they've done before, all of their hot pack and ultrasound and massage and trigger point and traction and all that stuff wasn't working. They realized that the trigger point injections and the epidurals and the steroid injections and the medication wasn't doing anything to treat the underlying cause, and they realized that they could have gotten out of pain quite a bit sooner and not suffered for all of this time and spent all of this money and all this effort. The most common neck problem is probably cervical radiculopathy, which means you have something like a disc bulge or a disc herniation or some other problem putting pressure on a nerve that comes out of your neck, and that nerve goes anywhere from down the back of into your shoulder blade or down into your arm, and you get anything from neck pain and or arm pain or upper torso pain, like pain in the back of your shoulder blades. A lot of people that have carpal tunnel, they don't have carpal tunnel, they have cervical radiculopathy. And this is the majority of the patients, right? So the carpal tunnel is an irritation of the median nerve. The median nerve actually starts from a bunch of nerve roots up at your neck. Irritation of those nerve roots up here causes all the same symptoms, and it'll get misdiagnosed as carpal tunnel. Most people that get cervical radiculopathy or like cervical issues, neck issues, they're anywhere between their mid to late teens and then maybe 60s. So it's a pretty wide range. I'd say most people at a certain point have neck issues that cause headaches, TMJ, eye pain, neck pain, obviously, shoulder blade pain, pain down their arm, in their shoulder, their elbow, their hand, their wrist. And you can pretty much get it at any age. The cause of neck pain or pain down your arm is from getting pressure put on your spine and on your nerves. So wherever those nerves go, you're going to feel your symptom. And when you go to and you don't realize this, and then when you go to the doctor and you say, I have wrist pain, or I have elbow pain, or I have shoulder pain, or I have shoulder blade pain, they look at those areas. They just get kind of tunnel visioned. And whatever they find at those areas, they're going to say, this is your problem. They're not going to realize that it's coming from your neck, where it often is. And you're not going to realize it as well. And it's annoying because there's a few signs that are really simple to look for if you had a history of neck pain, if you have symptoms on both sides, if there's any numbness or tingling, if it's the entirety of your arm versus just one area, right? Like if it's just the outside of your elbow, maybe you have lateral epicondylitis, tennis elbow. But if it's the outside of your elbow, your shoulder, and down into your arm, you absolutely have a neck issue, right? It's a neck issue causing your arm pain. It's not your arm. So a lot of people, they've had neck pain in the past, it goes away, and goes away, they basically get used to it. They get used to not moving that certain area. When they turn with their body instead of their neck, and they might not even realize it anymore. So they're not aggravating that same area, or they got used to the pain. Just like when you put your shirt on today in the morning, you knew you put your shirt on, but then your body starts to process it as a normal stimulus, so that way you can perceive change. The same thing happens with injuries. A lot of people don't really fully fix it. They just get kind of used to their new range of motion, their new limitations, their new symptom. And then A few weeks later, a month later, a year later, now you get shoulder pain and you forget, because you don't have neck pain anymore, you forget that you had neck pain and now you just think it's a shoulder issue. Or you had elbow pain and now you just think it's an elbow issue, but you forgot that you had shoulder pain and neck pain, and it's not 2 to 3 separate issues, it's one issue. It's one problem that keeps progressing and you keep chasing it, and you're chasing the symptoms rather than the cause. Neck pain was already one of the most common pathologies before the iPhone was invented, right? And ever since computers and the iPhone, all we do is this. All we do is this all day long. And at the end of the day, most neck pain can be treated just by extending your thoracic spine, extending your neck, and doing some chin retractions. If you did those in your daily routine, most people wouldn't have neck pain. But you do this for days, weeks, months, years, and think about it too. It's not just iPhone, it's when you're laying in bed. Most time people have 2, 3 pillows. When you're laying in bed reading or watching TV, when you're cooking a meal, when you're gardening, when you're doing any type of working with tools, you're typically looking down. We're looking down all the time, and that was significantly accelerated with our technology. That you see young kids these days. I took a picture of a kid recently at my daughter's basketball game. He was like this the entire time, right? And it's not uncommon. And now kids, even out at restaurants, right? Kids are sitting like this. We are like this all the time. And then it's no wonder that you're getting chronic neck pain and then people don't know what to do about it. Do the opposite. Because I know what I know and I do what I do, I'm on my kids before they go to school to do their foam roller, to extend their thoracic spine and extend their neck, and when they come home. Because I want to prevent neck pain, arm pain, headaches, dizziness, all the stuff that comes with neck issues. I don't know why my treatment approach gets pushed back when I'm saying move your spine and strengthen your spine in that range. And you get pushed back because there's people out there that they just want to protect your spine. They don't want you to move it, right? And then if they do strengthen it, it's these light isometrics that don't have any movement and have very little muscle contraction. And again, if you think about any other body part, your leg, your elbow, whatever, I'm never going to strengthen my quad by gently trying to move my leg like this and get a real gentle muscle contraction. The same thing with my neck. And then everybody wants to decrease the pain before you start the movements or before you start strengthening, and they don't realize that the movements and the strengthening are what decreases the pain. The pain is a symptom. The pain is a symptom of an underlying problem. Fix the underlying problem. Don't just manage the pain. And there's pain management, right? And in the title, it's pain management. It's not treating the cause. These people primarily do injections and give you pain medication. And then the surgeries that they do are often management, nerve ablations, right? Or putting a dorsal column stimulator. It's all just managing your pain. It does nothing to address the underlying cause. It's literally saying we can't address the underlying cause, we can only affect the pain, and that's what we're going to do. And as physical therapists, we've kind of done the same thing. Even though we get mad at the pain management side of it, we're doing the same thing with your lay down, do your diaphragmatic breathing, your relaxation techniques, your cognitive behavioral therapy, your hot pack, your ultrasound, your massage, your stim, your trigger point, all of this stuff, even traction. Nothing that I just mentioned does anything to create motion or to create strength in that range. Nothing. And what I just mentioned, I would say would be the bulk of any person out there, if they've gone to physical therapy for their neck pain. It's some of this, it's some of these, it's a hot pack, ultrasound, massage, traction, TENS unit, some form of manual work, which is normally stretching, suboccipital release or the therapist stretching, some trigger point, and that's the bulk of it. And again, nothing that I just described does range of motion and strength and control in that range. Just like anything in the world, we want the easiest solution, but unfortunately, that easy solution sometimes isn't a lasting solution, right? If you could just take a pill and your neck would have full motion and full strength, that would be great. But just managing your symptoms, just managing your pain will not treat the underlying cause. But it's easier. It's easier to let somebody massage you. It's easier to let hot pack and stim on your neck for 10 to 15 minutes, and it feels nice, right? And you leave and you feel a little bit better, but then your symptoms return within minutes, maybe days, but likely within minutes to hours, right? So now you've spent your time, money, and energy getting this passive treatment that only works on your symptoms. And I get that it feels better and I get that it's easier, but if you put it in the long run, just spending a few sessions working on your range of motion and your strength, a few weeks doing that to where you'll build up lasting relief versus years or decades chasing symptoms, managing symptoms, living with your symptoms. Like, which one do you want? So a lot of times if you're getting your neck treated and they're just managing your symptoms, your neck might start to feel better, but your symptoms will probably evolve. And what that means is that they'll actually start to worsen and you won't realize it. You'll have your neck pain and it'll feel a little bit better, but you won't be able to move out of a certain range, so your neck will stiffen. Or there'll still be pressure on your nerves, but you've got an epidural, you've got a cortisone injection, you've been taking pain medication, and now it was neck pain, but now it's shoulder pain. It was neck pain, now it's elbow pain. It was neck pain, now it's hand and wrist pain. And you don't realize that it's just more of the same problem. Rarely is a cortisone injection needed to treat neck pain. Right? And most of the time, it just really gets in the way of your rehab because now you're set up where you don't feel your symptoms anymore. You don't know where your pain limits are. You don't know where your range of motion limits are. You don't know how to tell your therapist what you're feeling. And they're using what you're feeling and how you're moving to evaluate your baseline and your progress. So you get a cortisone injection first, you come in, and now you're basically misrepresenting your case, your symptoms. And remember, the cortisone injection did nothing to address the underlying cause, did nothing to address the cause, just numbed you to your symptoms. And once that wears off, likely because you haven't been aware of where your pain and where your limitations are, likely you're worse. And now you need another injection. And then that injection didn't work as well. And now you need another injection. And now your doctor says, well, you're failing your treatment, so now we need to do more invasive care. And this is where it leads to a discectomy or a laminectomy or ultimately a fusion. And all along, you thought you were getting treatment, but you were just getting managed. People out there are going to say, like, there are time and place for these light resisted, these light movements. And yes and no. Yes, if you had a fracture, right, you need stabilization first. You need that fracture to heal. But then once that fracture heals, now you need to start regaining motion. You need to start, and you should do it through active muscle contraction through range. Do you need to go a little bit more gentle? Do you need to not go as far in range? Absolutely, but you still need active muscle contraction through range. Typically, if I'm discussing pain management with patients, I want them to do their exercises first, see what they feel after, and then if they need to manage their soreness afterwards, that's really where pain management comes in. Or getting a good night's sleep. I feel like that's a good use of a lot of pain management in order to get you through a good night's sleep, let your body heal, let your body rest, right? But before you do your exercises, no, because you want to know your limitations, you want to know where your range limitations, your symptom limitation. And ideally, the goal is to get you off of the pain medication as quickly as possible. It's not a long-term solution, and again, it's not a solution at all. It doesn't address the underlying problem, it just numbs you to your symptoms. And I don't want to be in pain, so I get it. I don't mind numbing my symptoms, but you need to combat that. You need to combine it with something that's ultimately going to address the underlying problem, and most of the time we don't. Even if people out there are taking pain medication and they know they need to do something, they're going to physical therapy, but physical therapy is doing more of the same. It's hot pack, ultrasound, massage, stretching, TENS unit, gentle stretching, gentle strengthening, nothing that's really going to promote full range of motion and strengthen that range. Nothing that's going to promote lasting changes. It just makes you feel good. And you're already doing a make you feel good with your pain medication. The biggest issue that patients do that gets in the way of their treatment is maybe two things. Number one, they don't do enough of what is working the best. They try to do everything at once, right? I talk with all my patients about minimizing the variables. Don't try to do 10 different things. Do one thing at a time, see how effective it is. If it's real effective, do more of it. Do it further in range, hold it longer, add resistance to it, add more resistance to it, do it more often, right? Instead of trying to, and I made this mistake a lot as a younger therapist. A patient would be doing well, and I'd say, all right, well, you were doing well with this movement, this exercise, let's add this to it. No, do more of the movement that's working better. And same thing too, if you are trusting your health to a healthcare provider, a doctor, a chiropractor, a PT, whatever. Give them the time. Give them time to work or fail, to follow their guidance. Don't see them and see another person, and you get different information from everybody. See one person. If you're getting the right treatment to the right area, within 4 to 5 weeks for chronic neck pain, you should be somewhere around 50% better. If that's the case, then you're on the right track. If not, then you're probably doing the wrong thing or maybe to the wrong area. With any recovery, it's not linear. It's not a straight line up. If it were, that would be easy for all of us, right? You'll have 2 good days, a bad day, 3 good days, a bad day, 4 good days, 2 bad days. The general trend is more like the stock market, and I discuss this with my patients, especially with chronic pain. You're going to have what feels like setbacks, but that's why you have to establish a really good baseline, how much it hurts, where it hurts, when it hurts, stuff like that. So that way you can look back and say, okay, I used to only be able to drive for 15 minutes before it would hurt, or I couldn't shift lanes, or I couldn't read for 20 minutes. And now I'm getting my neck pain, but I just read for an hour and a half. I'm getting my neck pain, but I just drove for 2 hours. Like, yeah, you're getting your symptoms, but you just did way more than you ever could before. So you have to have that comparison. So most doctors, to evaluate chronic neck pain, they're really going to rely not on your symptoms, but on your imaging. And it's such a mistake because imaging is more misleading and inaccurate than most people realize. By the time you're 40, they did a study where they took people off the street without any pain whatsoever in the 20s, 30s, 40s, 50s, 60s, and so on, different decades of their life. They had no pain whatsoever, and they imaged their spine, their neck. And by the time you're 40, you're about 60, 70% likely to have degenerative changes like a herniated disc, spinal stenosis, facet arthritis, disc bulge, all this stuff that is there, but without any pain whatsoever, right? So it's just a natural course of living life, aging. But what happens is you have a neck problem, you go to the doctor, their main tool is imaging, right? And whatever they find on an image, they're going to say, this is your problem, whether or not it correlates with your symptoms or not. And then they're going to tell the physical therapist, they're going to say C5, C6 disc herniation. They're going to say degeneration. They're going to say spondylosis. They're going to say spinal stenosis or lateral stenosis. They're going to give you a diagnosis based off of this image, and that diagnosis really isn't a great representation of you, but now that's what gets treated, right? The physical therapist knows how to treat spinal stenosis. The physical therapist knows how to treat degenerative disc disease or a herniation, and they basically just do that treatment rather than look at you as a whole, look at you, the person, listen to your symptoms, where they are, when they are, how they behave, what makes them better, what makes them worse. And that should be the evaluation that physical therapists have versus imaging. Imaging outside of trauma or ruling out something nefarious like a space-occupying lesion, tumor, something like that, outside of that, imaging gets in the way of treating. In my typical first visit, a lot of what I'm doing is listening to your symptoms. Like most of the time, the people that have come to me, they've been in pain for years, if not decades, right? They're telling me their story, when it first started, why it first started, what they did for it, how it helped, and then I just kind of work along the timeline. And then I want to map out their symptoms. Where are they? If they're saying I have neck pain, all right, when is it? Is it when you wake up? How long does it last? What do you do for it? If you work out, what can you do? What can't you do? If you have pain down your arm, when is it? How long does it last? All that stuff, right? So I want to map out the symptoms, but then I take a look at your movement and I look at your neck movement. I ask you about your symptoms, where you feel it, where you feel limited, why you can't go further. And then we start working on your neck. The typical area that we start with is the thoracic spine, the literal foundation, the base of your neck. Because if your thoracic spine is stuck forward, no matter what you do at your neck, it's still going to be limited. It's still going to have pressure on it. It's still going to be limited in range of motion. You're still going to get pain. But if you get your thoracic spine up first, you fix that foundation, now all of a sudden, A, you're already feeling better, and B, you're set up for success to actually do stuff at the neck. And again, my process is I've dropped pretty much anything that could be palliative, passive, temporary. Hot pack, ultrasound, massage, TENS unit, laser, trigger point, all the stuff that even if it does have some value, it really only has pain management value, temporary value. Drop all that and just show the patient how to improve their spinal mobility and then improve their strength through those ranges. All the time I'm working with patients with chronic neck pain, and day one they come in and they're like, ow, can't go there, 5 out of 10 pain. And then we do like one thing, maybe even in that session, or it's been one session and the next week, how are things going? Like, no, there's still pain. I'm like, oh, well, look to your left. I'm like, still a 5. You're like, yeah, like, I get it, it's still a 5, but now you have full range of motion. First thing is restoring range of motion, and then strengthen that range. And then as you're doing that, and as you've restored full range of motion, that's where that pain starts to come down. But if they were to go back to just this, they don't have pain there anymore. They can go all the way here until they hit their pain, but the patient's just focusing on it's a 0 or 1, right? Is the pain there or is it not there? The best way to show a patient progress is to first establish their baselines as much as possible. Show them what they can do, what they can't do, map out their symptoms, where they are, when they are, how long they last, what they have to do for it. Do you have to take medication? How much medication? How much does it help? How long do your symptoms last? And then each week, ask them about their symptoms. And at a certain point, what I'll do is I'll say, hey, let's go back and let's look at week 1. And you start reading week 1, and so many times people are like, oh, man, I forgot about that. I forgot that I couldn't drive. I forgot that I couldn't sit for 30 minutes anymore. I forgot that I couldn't play on the ground with my kids because now they've restored that normal, right? And now they got used to their new normal, which is their actual normal, and they forgot that they had this problem that was so limiting. So in my career for neck pain or chronic neck pain, I've used anything from mechanical traction machines, pneumatic traction machines, lasers for proprioceptive sense, little things that help with suboccipital release, hot pack, stim, Graston tools, gua sha tools, cupping. I've done trigger point. I've done a whole bunch of different types of taping. I've done different strengthening with different bands. I've done basically anything that you could think of. Again, I've been in this field for 18 years. I'm now an expert orthopedic physical therapist. And now I'm at the point where when I treat somebody for their neck, I pretty much use 2 pieces of equipment. I use a foam roller, and then I use a head harness with resistant bands. That's it. So if people are out there and saying like it sounds like overly reductive to say you don't need medication, you don't need this equipment, right? Think about what your treatment is doing for you. The 2 things that your body needs are mobility, so range of motion, and then stability, meaning strength throughout that range, right? Ask yourself if any of the treatment that you've been offered is doing that, is restoring motion or improving strength throughout that motion that you need. And I would bet that most of the people out there, when you really start asking this question, 95% of the treatment you're receiving doesn't do any of that. At this point in my career as an 18-year orthopedic specialist, I know that getting the patient stronger is really the way to treat neck pain, getting them stronger throughout the full range. Restore motion, but then getting them stronger. And nothing anybody does to you, outside of maybe injecting you with anabolic steroids, but even then you still need to do exercises. Outside of that, like nothing anybody does to you will improve your strength. It has to be on you. It has to be on the patient. It has to be that you have to understand this, and you have to know that you have to do this enough to improve your strength, to remodel your tissue. So you have to do it enough for a long enough time in order to actually get yourself out of the position, out of the state that you're in, right? Nobody else out there, nobody can come up to you and make you stronger. You have to, they can show you how to do it properly. They can show you how to do it progressively so that you don't injure yourself, so that you are successful, that you don't suffer setbacks, but nobody can make you stronger. You have to be the one that does it. So I think a lot of arm pain is misdiagnosed. I think a lot of arm pain, shoulder pain, is neck pain, is a neck problem. The nerves come out of your spine, so it goes brain, brainstem, spinal cord, spinal nerves, down and out, right? If my nerves from my neck go all the way down my arm into my hand, they tell my arm what to do. They supply my arm with information like pain, temperature, anything, right? If I have a problem up here putting pressure on the nerve, I'm gonna get misinformation down the line, right? It's like an electrical signal at your house. Like the outlet, you realize it isn't working, but it wasn't the outlet, it was the electrical signal getting there. But you noticed it at the outlet. That's kind of the way our body works, and that's why things kind of get in the way, right? That's why things get misdiagnosed, and I think this happens all the time, right? shoulder pain, it'll get diagnosed as bursitis or labral issue or rotator cuff tendonitis or tendinosis or tendinopathy or a tear, right? Or impingement syndrome or a bone spur. And it really wasn't any of these. It was a nerve issue, or the nerve issue is what led to the rotator cuff degeneration and then eventually fraying. The nerve issue is what led to the bursa becoming irritated. Remember, the bursa gets irritated by your nerve, right? Innervated by your nerve, not irritated. And this goes true with elbow symptoms. People that have tennis elbow, most of the time it's C5, C6 coming from their neck, and it doesn't even get evaluated, let alone treated, right? And inside of your elbow pain, it'll get diagnosed as golfer's elbow or ulnar neuritis, and you'll have surgery to move this ulnar nerve, transposition of the ulnar nerve in order to treat it and decompress it at this cubital tunnel. And it wasn't a problem here, it was a problem up at your neck. Carpal tunnel. Carpal tunnel gets misdiagnosed all the time. It's not a wrist issue, it's a neck issue. So for patients with neck pain outside of a fracture, neck braces will pretty much make you worse. Think about it. Your body needs two things. It needs mobility and then it needs strength through range. A neck brace will absolutely not promote mobility, and it won't promote strength through range. Your mobility will decrease, your strength will decrease, and then your strength through range specifically will decrease. So even if it feels good to just keep your neck there, it's like a lot of things that we have. Just because it feels good doesn't mean it's going to actually lead to solving the underlying problem. It's a temporary solution that, hey, maybe if you need for a few days, a few weeks, but you need to then do something to not need that neck brace. And most of the medical world has realized this, and you used to see people with neck braces a lot more often, and now you rarely see them outside of trauma and fracture. It sounds incredibly self-serving, but if you have neck pain, you should see my neck course. Within 4 weeks for most people, even if they've had chronic neck pain for years or decades, I expect around 50% improvements in 4 weeks. If it's just been a month or so, I expect 50% improvements within 2 weeks, right? Like if you had neck pain, you can go through the same process that I just talked about. You can go to your doctor and get a referral for an x-ray, and an x-ray or MRI is going to come back with degeneration or herniation or stenosis, and they're going to say, all right, we'll try physical therapy, and the physical therapy is going to do the same protect and gentle strengthening and just stretching that ultimately isn't going to work. You can see your chiropractor who makes you feel good for a little bit, and then you have to keep going back once a week for the rest of your life. You can go to pain management where they inject you with steroids or epidural, or they do medication that all it does is numb you to your symptoms. Or you can actually work on the underlying cause, and you can restore motion and strength. And that's what my neck course shows you what to do. If you're having arm pain, let's say you're having shoulder pain, that's primarily from like the mid to upper cervical spine, so like C3, C4, C5. You would treat this a little bit differently than you would treat like inside of your elbow pain. And the neck course that I have will touch on which areas of the neck that you need to treat for different areas of your arm, but I also have an arm course that does that as well. My neck course takes you through treating the neck to treat your arm pain, and it helps you make decisions on what you need to do based off of your symptoms. So as you're going through it, it's a little bit interactive in that way, where the first week it has some general mobility exercises for the spine, but then it gets more specific based off your symptoms. So if you're having upper cervical problems that are causing headaches and eye pain and TMJ issues, it tells you what to do. If you're having mid-cervical issues that are causing some shoulder pain, some pain down the outside of your arm or into your hand, it tells you what to do. If you're having lower cervical issues that are causing more of like posterior shoulder pain or pain down the inside of your arm or to your pinky, it tells you what to do. In order to start my neck course that I think works better than pretty much anything else out there that you're going to try, the only thing you need to start is a standard foam roller. You can get that on Amazon. We have it on our site, thespinaltruth.com. We have it as a equipment link. You can go to the equipment section, and there's a hyperlink to Amazon for that foam roller. For people with neck pain, even chronic neck pain, if they're doing my neck course within the first 2-3 weeks, they should be seeing fairly significant changes. So the cool thing about the neck course that I have for neck pain or chronic neck pain is that it shows you what to do, but then it also tells you that, you know, with anything, the course is predetermined, right? It's not necessarily specific for you, although I really try to make it all-encompassing and try to talk about the different presentations that you might have. But a lot of times what has happened is the patient gets through the course, through 4 weeks, they're doing really well, they've seen more improvement than they have with any other treatment that they've gotten, any chiropractor they've gone to, any physical therapist, any of the injections that they had, they've seen more improvement, but they're still having trouble hitting a certain area. For some people, it's the mid-thoracic. For some people, it's the lower cervical. For some people, it's the upper cervical. They're still having trouble. That's where booking a session with me or even a consult where I can help guide you a little bit, that's where that becomes so valuable, because then you got the majority of the information that you needed, the majority of the exercises, the movements that you needed, but now you need something just a little bit specific to you. They'll book a session within 30 minutes or an hour session. I can help guide you and help get you the rest of the way. In my neck course, I show you how to evaluate your symptoms. I show you a lot of the exercises, the majority of the exercises that you would need to treat the majority of neck pain. But then I also show you why I'm doing this, why I think the current medical system is kind of failing you in its evaluation, is failing you in its treatments, why most of these treatments are just palliative, just managing your symptoms, why doing this will lead to lasting results. I really try to make it where not only do you know what to do, but you also know why you're doing it. Because for me, that's what I want to know too when I'm doing anything. Like, there's a big difference between just knowing what to do something, but versus why you're doing something. And that'll help you in the future, because now when you get low back pain or knee pain, most of my patients start looking at their body completely different. They start realizing that, yeah, I have a knee issue, but I used to have a back problem, and that might be my knee issue, right? And before I go and get my meniscus surgically operated on, at the very least, I spend a visit or two screening and treating my back, right? Same thing with their neck. They started to realize that, hey, I was having elbow pain, but it was actually my neck. And now in the future, when they're doing something and they're having pain, they know that they want to look at their spine first, and they really start seeing their body different. For my neck course, it basically has you do somewhere around 20 minutes worth of exercises a day. And that's for about the first 4 weeks. And then it talks to you about how to wean off from that, because the goal is to get you to the point where you don't have to do anything, right? Like, you shouldn't have to keep taking this medication once a day for the rest of your life. You shouldn't have to keep going to the chiropractor once a week for the rest of your life. You shouldn't have to do exercises, feel better, symptoms come back, do exercises, feel better, symptoms come back. You should get to the point where you've done enough that very little maintenance will cause you to stay better. But you have to do enough at the beginning to get over that hump, to get your spine moving, to strengthen, to remodel tissue. And it takes a little bit of time. Like, again, nobody can come up to you and make you stronger. It takes time and repeated progressive load over that time. But once you get to that point, then I talk in my course about how you can start backing that down. Instead of twice a day, you go to once a day. Instead of once a day, you go to every other day. And then at a certain point, you have this quick 5 to 7 minute routine that you can put in before or after your workout, or you can put in once a week or once every other week. Or if symptoms start to, creep back, you can reinstitute or reinitiate and stave off any problem, or address the problem, or keep the problem away. So I talk to you about how to not only get 100% better, but how to stay 100% better.